All right, today we're putting on our detective hats. We're going to tackle a medical case that starts with just one single clue. It's a really common one, but it's also incredibly complex. Chronic diarrhea. This is a true medical mystery, so let's get into it.
So you've got this one persistent symptom, but it could be caused by dozens of things. How does a doctor even begin to unravel this? It's kind of like a detective showing up at a crime scene. The real work isn't just spotting the obvious clue, it's knowing how to analyze it and what other, more subtle evidence you need to be looking for.
So first things first, what are we actually investigating here? It's really important to get this straight. Chronic diarrhea isn't a disease in itself. Nope. Think of it more like a signal, an alarm bell that the body is ringing over and over, trying to tell us that something deeper is wrong. Our job is to figure out what that something is.
So our investigation kicks off by looking at the evidence up close. Just like a detective wouldn't treat all fingerprints the same, a doctor doesn't treat all diarrhea the same. The very first step is to figure out what type of clue we're even dealing with.
Okay, so right away we hit this huge fork in the road. The big question is there inflammation involved? Now, pus cells in the stool are a massive clue. But the real game changer is a lab test for something called stool calprotectin. If that level is high, it's like finding a perfect fingerprint that points directly towards inflammatory conditions, like inflammatory bowel disease. If it's normal, well, our search just got a whole lot wider.
Then you've got this other player in our little mystery, secretory diarrhea. And this one, it works in a completely different way. See, in this case, the intestines are actively pushing water out. It's not about what's coming in. It's about what the body is getting rid of, which leads to these really large volume, watery stools that just keep coming, even if you stop eating.
And this is just a brilliant example of why figuring out the type is so critical. I mean, think about it. Your first instinct, my first instinct, would be to drink less, right? To kind of stop the flow. But in this specific case, that is the absolute worst thing you could do. It actually makes the dehydration even more dangerous. It's a totally counterintuitive clue, but a vital one for the investigation.
Okay, now that we've had a look at our initial clue, it's time to line up the usual suspects. In this investigation, these are the main groups of diseases that are known for causing this kind of problem.
And on our big suspect board, we've got 4 main groups we're looking at. Inflammatory bowel diseases, which we already mentioned, malabsorption syndromes, which is basically when your body isn't absorbing nutrients the way it should, all sorts of infections, and even endocrine or hormonal issues.
Okay, let's dive in. We're going to open up the individual case files on some of our prime suspects and look for their unique fingerprints, those little telltale signs that set them apart.
In the IBD file, we've got our 2 main culprits, Crohn's and ulcerative colitis. Now, they both can show up with bloody diarrhea, but the pattern is totally different. Crohn's might just be blood-stained, and it often comes with other clues, like ulcers in the mouth. Ulcerative colitis, on the other hand, usually presents with obvious, frank blood, and it tends to stay in the colon. These tiny details are everything when you're trying to tell them apart.
Next case file, celiac disease. This is a classic malabsorption mystery. The diarrhea might come and go, sometimes for years, but the real smoking gun, it's in the lab work. The body just isn't absorbing things like iron, calcium, or protein properly, which leads to low levels in the blood and even physical signs like paleness or a really sore tongue.
Speaking of malabsorption, sometimes the evidence is, well, let's just say it's pretty direct. Steatorrhea is a huge clue. It's a very specific kind of stool that points a big flashing arrow towards a problem with absorbing fat.
And this is where the investigation gets super precise. We're not just guessing here. We can actually measure it. If a 24-hour stool sample has more than 7 grams of fat, boom, that's hard evidence. And a finding like that strongly points the investigation towards something like chronic pancreatitis, where the pancreas just isn't making the enzymes you need to break down fat.
And this brings us to what is maybe the most important part of this whole investigation. No single clue ever tells the whole story. The real detective work, the real art, is connecting the main symptom, the diarrhea, to all these other clues that seem totally unrelated but are happening elsewhere in the body.
Just look at these combinations. Each one of these is a different puzzle. Diarrhea plus joint pain? That's one investigation. Diarrhea plus weight loss, trouble seeing at night, and bruising easily? Whoa, that sends us down a completely different rabbit hole. Let's look at a couple of these. Okay, case file number 1. Our patient has chronic diarrhea, sure, but they also have these painful, swollen joints. What on earth is the connection?
And the diagnosis? Reactive arthritis.
It turns out the gut infection that started the diarrhea also triggered this crazy inflammatory reaction in the joints. The two problems weren't separate at all. They were connected from the start. Case closed.
All right, now for a much more complex pattern of clues. We've got the diarrhea, of course, but also major weight loss, trouble seeing in the dark, and the person is bruising from the smallest bumps. What in the world could tie all of that together?
And the diagnosis brings us right back to chronic pancreatitis. And it makes perfect sense when you see it. It's a story of severe malabsorption. The diarrhea and weight loss, that's from not absorbing fats and calories. The night blindness, a classic sign of not absorbing vitamin A. The easy bruising, that's a lack of vitamin K. It's a textbook pattern, once you know what to look for.
So as we close our case files, what's the big picture here? What's the fundamental lesson from this whole diagnostic journey?
Look, if there's one single thing you remember from all this, let it be this. A symptom like chronic diarrhea isn't the problem itself. It's a message. It's a really complex signal. And the whole point of the investigation is to listen, to gather all the evidence, and to figure out what the body is desperately trying to say.
At the end of the day, chronic diarrhea isn't the full story. It's just the headline. The real skill, the real mystery for both patients and doctors is looking past that headline to read the full, complex, and fascinating story the body is trying to tell.